Hello. We want to start off. Do you have any questions about any one concept?
Okay, you said in the chat. Thank you.
Yes, name, campus, and your professor's name in the chat. Do you have any questions about any specific concept? The concepts for week one are introduction to community nursing, the levels of prevention, healthy people 2030, and introduction to vulnerability. You need to know the difference between community oriented and community based nursing. Community based nursing is illness care, is focusing on that individualized care, whereas community oriented basing is focused on the community or that population as a whole. Community based nursing, you may work with maybe one or two individuals, but it's a difference than working with the entire community, or your focus or your intervention being focused on that whole community. With community oriented, your focus is on health promotion. And then with community based nursing, it is management, illness care. So a person has asthma, they may have hypertension, diabetes, and we're focused on them managing that care. Anytime someone is hesitant about, uh, for example, vaccines or the intervention that you're providing or attempting to provide for them, you want to give them some information so they can make an informed decision. Generally, for example, if we're talking about vaccines, we will give the person data on the mortality rates for that comparison. And that way they have information that they can then make an informed decision about. Public health nursing focus on preventative, not curative services. So we want to prevent. So that's primary prevention. So we're trying to prevent a problem. We're trying to prevent an injury before it ever occurs. We have three levels of prevention: primary, secondary, and tertiary. Primary is prevention, preventing the problem before it ever occurs, preventing that injury, preventing that chronic disease process, preventing even if it's influenza, a short-lived disease process. So, but we want to prevent that from ever happening. Some examples would be a helmet campaign, a seatbelt campaign. I mentioned the flu shots. Usually around August, September, they start promoting flu shots, and so they're trying to prevent someone from getting the influenza virus. And it also can include teaching just stress reduction techniques before someone becomes stressed out, so to speak. Teaching someone how to prevent from being exposed to pesticides. So maybe teaching that person how to put on their protective equipment so that they will not be affected by the pesticides or whatever they're going to come in contact with as they do their job. So we're preventing a problem, an injury. We're preventing something from happening. Okay, secondary is screening. We're trying to detect or determine. We're testing. We're trying to see. We try to early identify. So that could be routine screening such as mammograms, yearly blood pressure screenings, pap smears. Now that screening can be in the format of a questionnaire. For example, if we have someone that maybe have known exposure, for example, lead, back when they realized that lead was actually harmful to the human, they were doing lead levels on pretty much everyone that came in because lead was in everything. But since then, since we realize and know that the evidence shows that lead is harmful to the human body, Lead has been removed out of all those things that we would normally come in contact from day to day. But there's still some homes out there that may still have that paint that have the lead in it. So what they do is they have a questionnaire for that parent or guardian, but that's still secondary. We're trying to screen, we're trying to detect or determine if that person has been exposed to lead. And then, depending on that questionnaire, we can also draw lead levels. We can draw blood to determine what that lead level is. That is still secondary because we're trying to screen or trying to see or detect whether or not that person has been exposed to lead, or if we're thinking someone has been exposed to, or they have high cholesterol levels, we draw that blood and we see what their cholesterol level is. That's still secondary. Tertiary is treatment. Now, that treatment can be in the form of pharmacologic and non-pharmacologic agents. So there is a disease process there. There is some type of injury, and we're trying to get that person to be able to manage it, manage that disease process, so that that management helps decrease or reduce symptoms. And then in itself, that improves the quality of life. And examples of that is medication. Someone could be taking for diabetes, high cholesterol. It could be that person consuming a diet that's low in sodium or low in carbohydrates because they have a disease process where that diet will help them be able to manage their disease process. That is checking, doing finger sticks, checking those glucoses. And so that is, those are some examples of non-pharmacologic agents that we can do to treat or manage the disease process. So we have primary, secondary, and tertiary. Ms. Sheree, are there any questions about what we've covered so far?
So I just realized it's just you and I. Hello there. It's you said that managing the diet and your finger sticks for your blood glucose, those are non-pharmacological for tertiary
That's correct.
because they
Because
have the disease.
they have a disease. Yeah, exactly. It becomes, even though if that person has known hypertension, then that blood pressure screening, that blood pressure measurement that we're doing is tertiary, but it's non-pharmacologic. But if that person does not have that disease, then it's secondary.
Oh, I see.
Mm-hmm.
And if they were going to a clinic about blood pressure prevention, then it would be primary.
Exactly. And that clinic could be
Okay.
passing out information about, well, hey, do you really know what your numbers mean when you go to the doctor? Do you
Mm-hmm.
know that this, right, eating this and just passing out literature or having a conversation to
Okay.
prevent hypertension, then that's primary.
Got it. Thank you.
Mhm. Okay. So, Healthy People 2030. The primary goal of Healthy People 2030 is to achieve health equity, eliminate disparities, and improve the health and well being of everyone, of all groups. Healthy People 2030 looks at everything from A to Z that you can think of. It considers those social determinants of health, it considers the different life span from infant all the way to older adult. That Healthy People 2030, we have focused mostly on the reducing firearm related deaths. So gun violence is a risk factor for accidental injury or death among children. So if we are doing that home assessment, of course, we want to know where the firearms are stored, which is priority. We do want to still ask, well, where's the ammunition stored? We do want to know, well, have they taken some gun safety classes? Out of all of that, our priority though is knowing where those firearms are actually stored, and hopefully they are unloaded and in a locked cabinet or some type of behind lock and key. And then we do want to encourage them to store the ammunition separately in a locked device. But again, the priority is finding out where that firearm is actually stored. So there are many things that can have a major impact on our health and our well-being, and then our quality of life. And they call them social determinants of health. And it's pretty much everything from A to Z, and it falls under these six categories. You have safe housing. Just think about if we live in a place that's not safe for us to even go out and go to work or run, jump and hop, or the children play in the yard. If we can't walk or exercise in the yard or either the sidewalks on the sidewalks, then that has a huge impact on my health and well-being because I can't get out and exercise without having to travel somewhere else. Transportation. If I don't have a private vehicle and I rely on public transportation is not available in my area. How do I get to work? How do I get to my doctor's appointments other than, catch a ride with someone else or Uber or something like that? So social determinants of health, they're everything that is everything from A to Z. It's things that we might not have really thought about. It's water. Is our air and water safe for us to consume? And if it's not, how would that impact my health? So these things, they do have a major impact. Language and literacy skills. If your patient that you're taking care of, if they don't understand the teaching that we are reinforcing, if we're given a pamphlet, if we have them watching a video and that information is not in their primary language, if my primary language is German and it's in English, then I have an issue. That's a barrier. I'm not going to be able to understand what you're trying to get me to understand and know so that I can take care of myself. But then also,
They
if
might not ask a question the right way to understand.
exactly. In addition to that, I might have low literacy. I might not know how to read and write, or I may know how to read and write, but my level is low. So we do want to make sure when we're reinforcing, because we know the RN does the initial teaching, when we reinforce that education that we're providing, we want to ensure that it's in their primary language and that they do understand, and that we have established those therapeutic relationships so that if they don't understand or if they have low literacy, that they can come forth and tell us. So that won't be a barrier. That relationship that we haven't established will not be a barrier in itself to the care we're trying to provide. So access to nutritious foods, physical activity opportunities, education, job opportunities, racism, discrimination, and violence. All of these things are considered as social determinants of health, and they do have a major impact on our health and well-being. So when we talk about vulnerable populations, we think about the veterans, the very young, the very old, and those that have, more particularly, our veterans and those that have chronic illnesses because they already have some issues or some things that they need to do in order to be able to, so that they can stand a chance at having that greatest quality of life. So they have hypertension, it's a chronic disease process. If they have HIV, that's a chronic disease process. They have to be able to manage that in addition to all the other things that people we encounter as we journey through life. So that in itself makes them more vulnerable. Our veterans, we know that many times that they have post-traumatic stress syndrome, and we know our children, they solely rely on an adult, whether that is a parent or guardian, providing for them. That's everything from A to Z. That's getting them to their medical appointments, that's providing food, water, and shelter, their clothing. Yes, at 15 and 16, they can get a job, but that's not to provide solely for them. So they're vulnerable as well. Now, the older adult, they may have some type of assistance and they're not totally dependent on someone else. So, our most vulnerable will be our veterans, those with those chronic disease processes, and then those that are young. Education, like we mentioned, education plays a huge role in its income related. It is so higher levels of education leads to better choices. At least it should lead to better choices, and then or more choices. May not be better, but may have more choices rather than lower levels of education, meaning less choices. But it's not a one size fit all, but just the evidence does show that there are more choices in the event that someone is trying to, obtain a job, secure employment, if they have certain education or certain
Or
skill sets,
connections.
certain skill sets, whether or not that's soft skills and hard skills. Okay. All right, let's see. So, working with our homeless populations, we want to create that trusting environment. No matter what population we're working with, we want to establish that therapeutic relationship, that trusting environment. Trust is going to be essential in developing that therapeutic relationship. Tell them the truth, be assertive, be honest, and open with your communication. We don't want to not tell them what is the correct procedure that's for you to do. Even if they refuse a medication or some type of treatment, we still want to be honest with this is what's provided, and give them as much information as they can so that they can, as we can, so they can make an informed decision and let them know we're going to support their autonomy in the event that they refuse care, um, or decide not to, even though I think an example that we use is a patient, it may be that they're in pain, but because of whatever their beliefs are, they may refuse the pain medication at that moment in time. They may opt out for a non pharmacologic agent, or like changing position, changing the lighting rather than taking that medication. And we will support them in that. Just make sure that they have enough information so that they can make that informed decision. So let's go back. We went over, we talked about vulnerability, healthy people 2030, levels of prevention, and then introduction to the community. We talked about community based and community oriented nursing. All right, so then that takes us to week 2, which is the school nurse, growth and development, common childhood ailments, family nursing, and family health risks. Are there any specific questions about any of week two's concepts?
I think overall, there wasn't like any particular set of questions that I had. I think it's just because it's the beginning of the term. I'm just trying to orient myself. Does that make sense?
Exactly. Okay. All right then. So the school nurse, you wear many, many hats. Of course, you're mainly there for the school age client, but we do know we have the coach, we have the teachers, we have all the other staff. You're going to be that go-to person. The parents, you're going to be asked to come in. They call them IEPs, individualized education plans, which is mean the same thing as our care plans. You're going to be asked to sit in on those meetings to give your input, but mainly your clients are going to be the children, and you can provide an array of skills. Sometimes they may need indwelling catheter inserted. It may be in and out, medications administered, inhalers. You may have to provide that one-on-one with that child. You may have to assist with screening for scoliosis, CPR classes. It's delicious, does on and on and on. We're going to take care of all of our patients. When you are deciding who to take care of first, you want to consider your airway, breathing, and circulation. And then the bottom layer of Maslow's hierarchy of needs. So that helps you to decide which client, which child to take care of first, second, and so on. But we will ensure that, we will take care of all of them. We do not diagnose. So in the event that you have a patient that's displaying certain signs and symptoms and you do not have anything on record, on file for that child, we don't diagnose. So we recommend that they go for that full examination. We do ask the parents to take them in so that they can get that examination evaluation done. So you're going to be that safe place. So we do know that sometimes children experience bullying and abuse. So in the event that a child continues to come to you just consistently, they'll have to establish a pattern. Then they'll come every day, almost the same time, and they'll be complaining of whatever they're complaining of. But each time you have done your due diligence, you assess, your findings are negative, but they're still coming to you. So you want to create that therapeutic relationship with your students as well. so that in the event that they are experiencing bullying and abuse, that they will open up and tell you. Um, and then, so of course, like I say, usually they establish a pattern. They don't come out and say it, but you may see them because they're probably trying to avoid going to a certain class or being around certain people. So that's when they come see the nurse during that time of day. And that's what I mean what by they will establish a pattern. So we do know that sometimes parents are faced with unemployment, and then that does have a direct impact on the children, the parent being able to provide for that child. So just keep all that in mind that the parents may come to you and just, let you know, especially when it's time to refill medications or it's time for that, or that you recommend that child go for a full medical evaluation and the parent may be hesitant about going. It could be because they're underinsured or don't have insurance at all. And so right now, going to the doctor might not be high priority on their scale. So, but nevertheless, establishing those therapeutic relationships. You want to recognize some of our students may come from different backgrounds and may have different experiences as they're living. And so we do want, there are several programs out there that schools have partnered with so they can provide the different resources that are available in their community for the children and their family members. Because we just
Yeah, I was just
never
gonna
know.
ask, would I have resources to recommend for the family?
Exactly. You would. Now, the school nurse and the school counselor, and then some schools even have mental health on hand. And so you all will work hand in hand with identifying those resources and may even have a running list, but you all will communicate closely in knowing about the different resources that are available and then the steps to, and that's the other piece. How does the family, assess the resources that are available. So that therefore you all will have many conversations about what's available and then how does a parent gain access to those resources. That's a huge hurdle sometimes. So well, how do I even fill out the application? Where's the application at? How do I get these resources? So school nurse, the counselor, and sometimes some schools have a mental health staff on hand, and so they can identify resources. And many times there's a resource list, and then of course you have to pull the principals in as well. But usually between those, at least the counselor and the school nurse, they've identified the resources that are available in the community. And so we do want to hand washing. We said they say hand washing is the single most thing that we can do to prevent infection. So washing those hands before and after eating, before and after handling food, dressing changes, on and on and on and on. We want to make sure that we're briskly rubbing those hands together for a minimum of 20 seconds. And we want to rinse thoroughly, make sure that we dry and that we are routinely cleaning surfaces. So just make sure that, we are educating about that hand washing, making sure that stations are available. I even remember during the pandemic, we even had where it was a sink, like a pop-up sink, and it was connected to something and it was just like turning the water on in a restroom or something.
Oh wow.
Yeah, so washing your hands, it was not only just alcohol-based gel, but they had pop-up sinks. It was just readily available. So washing your hands was not a problem. I had never seen that before. The little pop-up sinks. Um, and so, but that was good. But we want to promote hand washing those hands. So, public health nursing, as I mentioned before, focuses on preventative. That's that primary level of care. Prevent something from happening. Prevent sports injuries. Educate for the most part, not the principals, the coaches. They know about stretching before and after. You want to prevent those injuries, making sure that they are weather aware. If it's hot, encourage them to do those frequent fluid breaks so that we will not have those heat injuries. So that's that preventative. That is that primary level of care. But school nurses will triage many complaints, but we want to prioritize following the ABC. Prioritize using that, and then go to Maslow's hierarchy of needs if there's not an issue with airway, breathing, and circulation. That bottom layer is food, water, shelter, comfort. So we want to allow that to guide us as we make decisions about which student to take care of first. So regular checkups are recommended at least every 2 years to assess growth and development. We do know that we're not for vaccines and we're not against vaccines, but we do make the information available. So if anyone is hesitant about any type of vaccine, we usually provide that mortality rate of the vaccinated versus the unvaccinated. And that way that parent or guardian can make an informed decision with data on both sides. And then they just make a decision about what they want to do for their child. Asthma is a common childhood ailment. It is very common, and we know that asthma causes those bronchospasms, increased mucus production, and it can be triggered by vigorous exercise, extreme weather, and different allergens. So, if a person has not identified their trigger, we want to suggest to them to keeping a journal. When are you having these asthma attacks? What is going on? What are you around? What have you just eaten? And that journal can help them piece together. Well, it's when I go to my grandmother's house who has, a pet, goose or certain or carpet or whatever. But anyways, I don't know where that goose came from. But the whole point is identifying what is that trigger. And so we don't want to prevent our children from participating in physical exercise, but sometimes vigorous exercise is the trigger. And then once they found out that that is the trigger, most of the times the children will be on a medication prior to that vigorous exercise. We don't want them not to participate. We want them to run track, play basketball, and all of those things. But once we've identified what the trigger is, then that they will prescribe accordingly. For example, if it's vigorous exercise, more than likely they're probably going to pre-medicate in addition to have that rescue inhaler on hand. But if they know that vigorous exercise triggers them, they're going to probably have medication before.
Right.
And then there's a thing called a spacer. What that spacer does is just a plastic barrel that's attached to the inhaler. It improves medication delivery. So sometimes your children will have those spacers.
Easier for the kids to use.
And so what it does, it ensures more of that medication is actually delivered rather than that child just having that inhaler in mouth by itself. But that barrel, that spacer helps that it increases the amount of medication that child closer to the actual dose that they're supposed to be getting. Because you do lose some of it. If their lips are not correctly positioned around that inhaler, then they're going to lose some of that medicine. So they're not going to get that correct dose. But then that spacer ensures that you get closer to the correct dose. So children with asthma, they have a greater risk of having complications if they're exposed to secondhand smoke. So educating our parents on creating that smoke-free environment. Sometimes they may say, well, I'm not smoking the traditional cigarettes, but I'm vaping. It's just as bad. We want them to be around a smoke-free environment. Stuffed animals and carpets, they're not desirable. So if they can avoid being around those, because what they do is the dander, the little
it's trapped.
dust, exactly. It traps and holds on and grabs a hold to the little nice little stuffed animal, and the carpet, it is just there. And so it's not desirable. Exercise is important, so we don't want to avoid exercise. But if they find out that exercise is a trigger for them, more than likely they're going to medicate them, pre-medicate before, they actually are involved in the vigorous exercise. So we have atopic dermatitis, which is also called eczema. It is a inflammatory condition of the skin. And so they use those emollients such as oatmeal and then those non-steroidal creams. I think Elidale is what it's called. That we do want to encourage the child not to use perfumed soaps. We want them to use non-perfumed mild soaps because those perfumed soaps is going to more irritate that skin. It's going to irritate that skin more. And a person that has the atopic dermatitis, which is called eczema also, they more than likely, if they have to take a medication, it's going to be an antihistamine and it's used to treat the itching. It's used to treat that pruritus or itching, as we call it. So you want to keep that skin nice and lubricated. And then if they have that intense itching, just know they're more than likely are going to be put on an antihistamine. Corticosteroids are not routinely used. It's usually the antihistamine that's usually used for atopic dermatitis. So we have type 1 diabetes. It's the autoimmune destruction of the pancreatic beta cells leading to insulin deficiency. There's not enough insulin there. And then, so, our children, they may experience some type of grief or sadness because it seems as though that their life has changed forever. So we do allow them to express, whatever it is that they're feeling because, those feelings are real and they're valid. And if our child if they're at that point where they want to, and the doctor and the parent or guardian says, hey, it's safe for them to start doing their own injections, we can allow them to use a stuffed animal. Now they do have mannequins shaped up like that you can actually place around your arm or your leg. You just strap it on and they can actually practice those injections so that they can become, comfortable with the procedure and the drawing up of the medication. More so, the injection part is what most people have, are kind of hesitant about. So one goal for a child that has type 1 diabetes is that the child will be able to measure that glucose level using that glucometer. And so this in itself helps that child have a sense of ownership and a little bit more control over what's going on with them. And so, and then in addition to that, checking the glucoses, also being able to administer those, do self-injections, of course, with the proper supervision. But as a school nurse, you're going to have all that documented on the doctors. They have an order. They say self-administered. You don't have to wonder about anything. Their orders specifically say how that medication should be administered. Acute conjunctivitis. So the membranes that lines the eyelids, they're inflamed. And then they can be caused by various things, bacteria, viruses, allergens, toxins, any type of irritant. And so bacterial conjunctivitis is infectious. So usually someone that has bacterial conjunctivitis, the other eye is usually going to get infected as well. But if it's like an irritant and it just gets in that one eye, then you usually see the single eye affected. But we do want to teach hand washing, avoid touching those eyes, and then take the medications. Usually they're prescribed if it's bacteria. Of course, you'll get your antibiotics. It'll be in the form of ointment. Most of the time it's an ointment. And usually that child is able to return to school 24 hours after those antibiotics have been started. We don't put ice packs on the eye, but we can apply a warm compress. A warm compress can be applied to that eye. Okay, we said the frequent hand washing.
Why not a cool cloth? Just asking.
So it's just not recommended.
Okay.
The warmth is what's recommended. Not hot, but just like lukewarm. Scabies is caused by a parasite that actually, it literally burrows just under the skin. And of course, it causes that intense itching as well. And so the treatment is that cream, that parasite cream, eliminate, or something like that's what it's called. But it's an anti-parasitic
Methering, is
cream.
that what it is?
That could be, it's there's one of them. That is two different ones. But we need to, the clothing, the bedding, the stuffed animals, everything needs to be washed and dried on high heat. So, and those things that are non-washable needs to be bagged for at least a week. And so the thing is, the mites should start to die within 3 days if they're bagged up. Anybody, family members, babysitters, anyone that's come in close contact, everyone has to be treated. Everyone has to be treated. Stuffed animals and toys, again, you want to tie those up in a bag and they need to be stored in that bag for at least 1 week before we reuse them or come in contact with them. But everyone must be treated. Everyone will require treatment. Okay.
So everybody that's been in close contact, they need to go to the doctor and get their version of a topical treatment.
Yeah, usually what if one person's infected, they'll ask who's been in the house, who have you been in contact with, and they'll go ahead and they don't have to really. Most of the time, they don't have them to make a doctor's appointment, but they'll go ahead and have that prescription ready for them. And a lot of times they'll notify them. Just depends on that doctor's office,
Okay.
but everyone's going to be treated. Everyone, even if it was the babysitter that just came over for that hour, everyone's going to be treated. Yeah, because those little things, they get up on, like, they literally just burrow right up under the skin.
Oh
It's
wow.
a yes. So head lice or louse, they lie on their little nits at the base of the hair shaft. Itching is a common symptom. And they're easily transmitted by sharing combs, brushes, person to person, and hair hygiene usually doesn't have anything to do with it. It's just that those little nits are on someone's hair, and if we share a comb, it just spread like that. So it's easily transmitted. But hair hygiene usually has little to do with the head lice or the transmission. The parasites, they even on hats and combs and hairbrushes, and it just can spread from one child to the other because usually what are they doing? They're sharing hats. Let me wear your hat, and just that that contact you'll end up with a widespread outbreak. So we do want to encourage family members and playmates to be examined and then just treated as necessary. ADHD is the inattention, the distractibility, and the increased gross motor activity. And sometimes people have that impulsivity where they're, just impulsively do something. And so sometimes people are on medication. Sometimes people have just coping skills. And sometimes people just have those environmental adjustments that are made. So it's not an automatic that someone's on medication. It's not an automatic that they will just have environmental adjustments, but they can have any of those. The child may want to sit in front of the classroom because that's an environmental adjustment because it's less of a distraction. If you're in the back, you see everything everybody's doing. You do want to encourage the teachers because, like I said, many times you'll be called in as a school nurse on the education in the individualized education plans. And those are care plans in a school setting. And you want to encourage them to give those clear, short directions rather than several steps all at once. Okay. Well, you want to just make sure you're clear and give a few instructions, directions, and then repeat them as often as needed. We do want to provide that child with frequent breaks. If the child's on medications for that, the child may even need reminders to take their medication. And a lot of your children in the school setting that's taking medicines for whatever, sometimes they'll be so consumed with just the daily school life that you'll have to remind them to take their medications. And some medications will decrease the appetite. So the school nurse can partner with parents and teachers to ensure that the child is not experiencing any nutritional deficit. So we might have to weigh the child, keep a weight journal, a intake journal just to see how much food they're consuming, because sometimes those medicines cause them to not eat as much food. But we do not isolate children. We don't isolate them at all. Okay. Iron deficiency anemia is more likely in infancy and adolescence due to growth spurts. So, high iron foods, good nutritional sources include those eggs, liver, red meat, those green leafy vegetables, that cream of wheat, dried fruits, beans, nuts, whole grain bread. Those are things that we want to encourage so that we can replace. If left untreated, if left untreated, it can lead to heart failure. The in signs and symptoms that we will see, there will be edema, pitting and non-pitting in the extremities. That person even will become short of breath, because if it's left untreated, that anemia can actually lead to heart failure. Untreated iron deficiency anemias, they don't just all of a sudden just wake up one day and they're having problems breathing and they're having this uh, extremity edema. It's progresses slowly, and then so you may start seeing a little weight gain. The person may be complaining a little short of breath here and there, and then because it progresses slowly. But if left untreated, it can affect that heart, causing heart failure. As a school nurse, you will be asked sometimes to assist with screening for scoliosis, which scoliosis is that S-shaped curvature in the spine. We have that child to bend forward at the waist. And if in fact that there's scoliosis, the one shoulder will be higher than the other. And the arm to the body space, it'll be unequal. One arm may appear longer than the other. And so usually the school nurse and then the physical education teacher, they're usually the ones that kind of oversee this. Now, there is another type of scoliosis called functional scoliosis. It is not a spinal disease. Functional scoliosis is not a spinal disease. It is caused by poor posture. So the traditional scoliosis is a spinal disease, and that's when the students will have that S curvature, and they'll have that one shoulder higher than the other. Those are things that we'll assess and actually see. But functional scoliosis is usually caused by poor posture. Remember grandma saying, hey, sit up straight, stop slouching.
Yeah.
So, yeah, and that can lead to functional scoliosis. And our intervention is just to encourage good posture. Okay, lead exposure, kind of mentioned that earlier on. Um, Lead it is harmful to the human body. In children, we will see developmental delays, cognitive delays. Those any the signs and symptoms initially, that child may be feeling headaches, stomach aches, they may have constipation, they may even seem clumsy. But what's going on, that development is being delayed because that lead is harmful. Usually is in older buildings, and that paint is deteriorating. And what children like to do, they like to run, jump, and hop. They on purpose fall down. They're touching their mouths, so they may be ingesting it orally as well as it being absorbed through the skin. Treatment includes removing whatever that exposure is. And if it's in that home, they have individuals, and I forget what kind of certification they have, but there's a certain way to remove it. And then they would have chelation therapy. That child may have to go through chelation therapy. But if it's in the home, then we have to remove it. Excuse me. The professionals, they actually come in and do some type of sanding. It's some process they use to actually remove it.
Are you saying chelation therapy for the child?
Yes. Mhm. So obesity is the greatest, highest risk for children. We want to get them to get up and move. We want to avoid 100% fruit juices because those have empty calories in it. It seems like when we say 100%, that would be a good thing, but those fruit juices really do have empty calories. So we want to avoid sugary snacks that includes those 100% fruit juices. We want to encourage the parents not to use food as a reward or a punishment, and for them to pay attention to the child when they're saying that they're hungry, because sometimes they'll get off. We're used to our meals, breakfast, lunch, and supper, but sometimes the children will be on a different food zone, so to speak, and so the parents will need to pay attention to those cues that the child is giving to them that they're actually hungry. We do want to encourage that child to get up and move. And so decreasing the screen time, what after school activity you want to participate in, where we're gonna do this weekend, going bowling, cornhole, all these different activities will get the child up and moving. What is the thing that they going outside and trying to catch the fireflies and butterflies and things like that? But something to get the child up and moving is the whole idea. And because obesity leads to other health problems, especially if obesity is experienced in the child early on. But we do want them to avoid the sugary snacks and avoid the 100% fruit juices. Okay. So week 3, we're going to talk about migrant farm workers, rural populations, homelessness, and poverty.
Week 3 is on the exam.
Yes.
My gosh. Okay.
Mm-hmm. So the migrant farm workers, remember, these are individuals that are just coming to complete the work in that amount of time. It's not like a whole year. It's usually seasonal. They're coming to help the crops grow and then harvest the crops. And then they're going back to, their wherever they're from. And so usually they use pesticides because the pesticides, those are the things that usually love these fresh growing plants. So got to keep the pests off the plants, because otherwise they'll eat the plants up. They will literally eat the plants up, and then we won't have anything to harvest. So migrant farm workers usually use pesticides. And so that repeated, that chronic, that long-term exposure to those pesticides, that person has a increased risk for cancer. Memory loss, skin rashes, and headaches are all side effects of short-term exposure to those pesticides. But that long-term and that chronic exposure, that person may end up with cancer, because remember, it's a pesticide. So we're using that to kill the pest. So if we don't wear the proper protective equipment, then they're coming in direct contact with something that's used to kill a pest. So we do want to ask them to ensure that they're wearing the appropriate gear. And even when they go home, they, especially if they have a wife or loved one that's pregnant, they don't want to come in contact with those clothes that they're wearing. Those clothes should be laundered separately. They need to take those clothes, remove those clothes before they actually intervene and interact with their other family members. Because if they don't, then if they're touching, then those family members are coming in direct contact with what's on those clothes. And so we kind of don't think about that. But yeah, so we do want to encourage less exposure as we can to those pesticides. Were you asking something?
No, I was just saying contaminating their home or their family members by coming inside.
Yeah, exactly. That's exactly what happens. They contaminate. Mm-hmm. For some migrant workers, because they don't really live where they're working at for that amount of time, and it may be 1 month, 2 months, then sometimes there are language barriers, sometimes there are culture barrier differences often exist, sometimes there are crowded living conditions, because sometimes because the employees only are there for maybe 2 or 3 months out of a year, the housing might not be in the best condition. And so there might not be that many opportunities for housing. So sometimes housing conditions are crowded. And then sometimes they're poor. The conditions are poor. And so we want to consider that, especially if we're having we're working in the community clinic. We're seeing everybody come in, for example, with a stomach virus. Okay, well, wait a minute. Where are you all coming from? Where do you all work? Where are you all staying? And so we want to see if there's any commonalities in where these people are coming from, but because it could be an outbreak in, wherever they're actually living, their housing.
Right.
Mhm. Migrant farm workers usually do not have available resources because remember, a lot of times they're
Right.
traveling from out of state. This is not where they usually live.
Right.
And so those resources just are just not available to them.
Available.
And sometimes they're not, most of the time they're not covered by the employee health benefits. It's on them to get their own benefits.
Right.
Um, like SNAP, the supplemental nutrition assistance programs, those things are not available because that is not their permanent residence. And
But
so,
let's be honest, they might be an illegal citizen.
exactly. And so those resources are just not available to them. Mhm. So the rural population, remember, they're more spaced out. So they might not have all the resources that are available, especially specialists. Some areas don't even have hospitals. They have to travel 30 minutes to an hour or more just to get that level of care because with those areas, things are just more spaced out. And so there's a lot of land that has not been developed. And so specialists, what we're seeing now is specialists will come in to those areas maybe once or twice a month, and that lessens the chance of people having to travel every time for their specialist appointment an hour away and having to take an entire day off work just to go and come back. So that
But
access,
does that bombard the doctor's office with a full roster of people to see?
exactly. And then think about the number of people that say, well, hey, I got to take a whole day off work just to go see this doctor. How many don't
They're not
go?
going to comply. Yeah,
They're
they're not
not going
going
to comply because of that access. Access is a real barrier. It's a real thing.
to. Right.
And so, but because those areas are just not as developed and things are just so spaced out, they don't have the hospitals. There are so many hospitals across the country in
That
rural
are
areas that
closing.
are closing.
Mhm.
It's really, it's real. It's real. It's not, this is real. So the characteristics of that rural areas is that more space that they have, those greater distances that they have to travel, and that in itself is a barrier to access to healthcare. And so we may work in shelters. We want to consider, and going back to the migrant farm workers and the close living quarters, we want to think about tuberculosis and those diseases that are easily spread with close contact, airborne, because if they're living in close quarters, just that stomach virus is that one person doesn't wash their hands or doesn't do something to prevent the spread of infection, and
Right.
here we go. Everybody,
A
you
chain
have
of
a
reaction.
exactly, and that'll happen too in the school area, in the school settings as well.
Right.
I forget the percentage, but if so many of your students, a certain percentage, end up with the same thing within that time frame, then we have to report it to the authorities because we can have like a little mini outbreak of something. But it takes that one person not washing those hands, breaking that chain, and then there we go. Homelessness, of course, is correlated with those poor health outcomes because we're just more focused on somewhere safe to live. We're not thinking about taking any medications. We might can't go to work, and so that in itself equals a lot of times poor health outcomes. So we do want to identify those resources that are available. Sometimes there are housing programs. There's even some doctors' offices have indigent funds for the day or for that week, so they can provide so much of care free of charge, so to speak. And so we want to identify those places and resources so that, people have a chance on it. Most of the time, it's not that people don't want to take care of themselves. It is the resources and the steps to and the how to.
Right. The steps
And
and how. Yeah.
yes, in maintaining that. And because healthcare is expensive. And so if you don't have insurance and if you're underinsured and you have to go get a test, blood drawn, or MRI, Those things called, oh, they're astronomical. So the greatest impact on a child's overall health is that financial stability of the family, because that child solely relies on that parent of guardian providing for them. So the greatest impact of a child's overall health is the financial stability of that family. So if something happens where a parent loses a job, then that whole situation becomes unstable. Decreased finances, the decreased income, it does impacts that family ability to access healthcare. Because if we have $500 to keep the lights on, put food on the table, or go see the doctor this one time, we more than likely are going to keep the lights on, put food on the table.
Right.
We're probably not gonna choose going to the doctor
Right.
and risk the lights being turned off, the water being turned off that one time. So it kind of like a domino effect. So the home environment, the location of schools, and a parent's medical history, it can influence the health outcome of children, but it does not have the greatest impact. The greatest impact is going to be that financial stability of that parent, whoever that parent or that guardian, who's ever responsible for taking care of that child. So we do want to create those trusting environments. Trust is going to be essential to developing those therapeutic relationships, whether or not we're talking about homeless shelters, migrant farm workers, any population. You're the school nurse. We want to create those trusting environments so that we can establish those therapeutic relationships. And so, in the event that something's going wrong or they have an issue with something, they're more forthcoming in saying, "Hey, I have an issue with this, or I don't understand, or or this doesn't make any sense to me." And so that they'll have those conversations with. All right. So we have covered concepts 1, 2, and 3. I will encourage you to go back and review each. There are 5 of us. So exam reviews, make sure you review each of them. Go back and review your classroom recordings for each week, 1, 2, and 3. And also, we have placed several resources. We have Cahoots. Go back to each week's announcements. We've placed several resources there. Cahoots, we have different professors reviewing concepts. We have a study guide there for you. Go back through your classroom recordings, and please make use of those resources that are there. Reach out to your professor in the event that you need one-on-one. Send an email if there's a question about a concept. We can do an email exchange. Um, we have office hours. We are available.
The
This
only thing I
recording.
didn't see was, sorry to cut you off. The only thing I didn't see.
Welcome. You take care. Happy learning.
Have a good night.
You too.